Hello. Today I am going to be talking to you about the basics of confidentiality, informed consent, and advanced directives. Confidentiality is confidential information that is being shared explicitly with the patient and not with anybody else that's on a need to know basis. Anything the patient tells the healthcare provider in private or in confidence is not to be shared and is confidential information. Anything pertaining to the patient's medical record as well, anything being done, any medical procedures, health history, family history, anything like that, none of it can be shared unless it's on a need to know basis. The Health Insurance Portability and Accountability Act, also known as HIPAA, was a very important factor in patient confidentiality. The HIPAA is a set of provisions to ensure protected health information is PHI, that is not released to any third party without the patient's permission. Patients have a right to know how their PHI is being used, and that is only on a need to know basis, as I said, is very important. Don't be sharing information with your coworkers sitting next to you in the next booth or the next hallway over, letting them know what's going on with the patient. They don't need to know they're not taking care of this patient. Charge nurses, you, doctors, RTs, PCTs directly involved with the care, they may need to know what's going on, but otherwise don't be sharing information unless it's important and on a need to know basis. Now, disclosure is a hard thing to understand. You should never give out PHI, like I said, unless you have explicit permission. The patient must have the mental capacity to give you the explicit permission as well. That is, they understand, retain, and balance the information and also communicate their decisions. Okay? Explicit consent may be written or verbal and is the preferred way for the information to be disclosed. That is, the patient explicitly tells you, yes, you can tell my mother or my father or my son or my daughter this, and you have it in written in an admission paperwork of some form, usually, that lets you know it's okay to share with this person and not okay to share with this person. Or there may be a do not share any information and no info patient, and you can't tell anybody. Also, the patients can decline to give information to other providers in the healthcare facility, and that's their right if they don't want their information shared, but it can limit the amount of care the patient receives, which is inversely affects their health and how well they get. Some of the consequences of breaching confidentiality are exposure to civil suits, where you can be sued by the families or the patient, disciplinary action by the State Board of Nursing, removing your license and whatnot, job loss, you can be fired, and then fines based on violations of HIPAA. So when is it okay to breach without consent? That is, in certain cases where courts ask for information regarding a patient, you must disclose the information because it could be held in contempt if you don't. And it is only used in a private matter, therefore they don't consider it disclosing information. It's also allowed when you're protecting a third party from harm or abuse, like a child or an elderly person. If you see them come in with bruises into an ER or onto your floor, they look like old bruises, it's your responsibility to alert the correct authorities in this consequence. Also, when it's to prevent a serious crime, like a terrorist attack, if somebody told you they were planning on bombing a school or anything like that, it would be your responsibility to let the proper authorities know. It wouldn't be a violation because you're protecting the public at large, and the public comes before the person. In most cases, you have to use your nursing judgment, which we've been trained to do. We know when to use it correctly. Just use your judgment correctly and don't overstep your boundaries. Share if you know you need to share. A lot of times it's common sense, sometimes it's not, but in cases like that, yes, it's okay to disclose information. Also, public health with highly contagious diseases, the CDC, public officials, they need to know if there's a contagious disease out there. Although AIDS HIV, these things aren't always considered this. You cannot share information about HIV unless the patient tells you can with somebody they may have given it to without their permission. Informed consent is a process of explaining a procedure to a patient and then having them sign a form or having them understand what the such treatment is going to be. The Joint Commission requirements on this are that the hospitals must have policies in place to obtain the consent. It must be documented in the medical record and contains discussions of the treatments of risk, benefits, likelihood the intervention will work, and alternatives, including risks. Consent forms follow all Joint Commission requirements. Descriptions of proposed procedure and anesthesia, risks of refusing the treatment, and lists of the practitioners involved in the treatment. Obtaining consent is always the physician's responsibility. The physician has to let the patient know what is going to be done, the risks, benefits, all of the above, before the procedure is done. The nurse comes in and then witnesses the consent. You should never witness a consent. I've learned this from personal experience unless the doctor has already talked to the patient. A lot of times they will order you to obtain the consent, the witnessing of the consent, even though the doctor hasn't fully explained the procedure to the patient. So if you're not comfortable witnessing the consent, if the doctor hasn't done everything they're supposed to do, don't witness it. But it is always your responsibility to make sure a consent is done and signed before the patient goes for any procedures. Emergency exceptions to this are if the patient could die or obtain injury if they're not given it, unable to give the consent, from they're unconscious, the next of kin is unavailable, and a person would normally give consent in this instance. Incompetent patients can't give consent, and some vulnerable populations are minors, elderly, that have dementia, foreign language speakers that need translators, or blind and deaf patients. And then advanced directives is the last things I'm going to talk about. It's a document that just says what you want done in case you were incapacitated and couldn't speak for yourself. Aspects of advanced directives are medical proxies and the living will, and the importance of it, and the DNR. And some of the importance of advanced directives are can save money for families and the patient and the facility, takes burden off the family, and gives respect and dignity to the patients in death. One thing to know about advanced directives is always make sure they fill them out fully. They don't just get a proxy to make decisions for them. They put the decisions they want in place if they were unable to speak for themselves. Thank you for your time. I hope you enjoyed this.